Hi, I'm Christine Vipon, member of the Breaking Through Task Force.
And I'm Marie Holland, licensed clinical mental health counselor supervisor and licensed clinical addiction specialist. We are here to talk to you about depression.
I want to introduce you to my lifelong companion, depression. My symptoms began early in life, around 9 years old, and by the time I was 13, I decided that life was not worth living. I struggled with feelings of worthlessness and hopelessness. I didn't sleep well, felt tired all the time, and I didn't want to be around friends or family. I also had unexplained headaches and stomach aches.
Symptoms of depression can vary greatly, but they do include feeling sad or having a depressed mood, loss of interest or pleasure in activities that you once enjoyed, changes in appetite, weight loss or gain that's unrelated to planned dieting, trouble sleeping or sleeping too much, loss of energy or increased fatigue, increase in purposeless physical activity, such as an inability to sit still, pacing, hand-wringing, or slow movements or speech, and finally, thoughts of death or suicide. Sometimes we are sad, and that's a normal emotion to experience, to many different things. But if your sadness has lasted for more than 2 weeks or is reoccurring, it is likely depression. Depression is a common and serious medical illness that is fortunately treatable, especially when detected early.
Because my parents were embarrassed by my suicide attempt, I didn't receive any type of treatment for my depression. The one thing that kept me from trying again was a youth pastor who reached out to me. I got involved in different events, and I knew the pastor was only a phone call away. Still, I spent the next 9 years trying to get happy. This included risky behaviors and self-harm.
Depression affects your mood, thoughts, feelings, behaviors, and physical health. Severe depression can result in losing the ability to feel pleasure in the things you once enjoyed. It can also cause you to withdraw from your social relationships, even from people to whom you are closest. Untreated depression can lead to self-harm or, in extreme cases, suicide. There is often an increase of physical aches and pain, insomnia, or oversleeping and weight problems, which in turn can lead to cardiovascular problems, raising the risk of a heart attack.
In my early 20s, my mother and husband were suffering from cancer at the same time. I just couldn't pretend to be happy anymore. I sought out psychiatric help. Over a couple years of therapy and trial and errors of antidepressants, I found what worked for me. I learned that I'm a person with major depressive disorder, a persistent and often genetic disorder that can affect the brain chemistry.
There are different kinds of depression. Depression can range from peripartum depression, which used to be called postpartum depression, to bipolar disorders. With the right diagnosis and treatment, many people can overcome depression. The first step is to talk with your family physician and ask for a full evaluation from a psychiatrist, psychologist, or other licensed mental health professional.
I've been managing my depression for many years now. Periodic therapy and antidepressants have been a great help, but even more so is my belief system and the support of my husband, friends, and family. My husband and I have a plan. He knows what signs to watch for if I start to spiral. I know I do not have to feel ashamed or scared about talking about my depression. Most people are very supportive. My openness to talk about it has not only been therapeutic to me, but has helped others in my family recognize their own depressive issues. Over the years, I have had many opportunities to share my experiences with depression. In response, many people have shared their own experiences with me. We have learned from each other and built upon each other's successes, demonstrating that raising our voices breaks the stigma associated with mental health issues.
If you or someone you know is dealing with depression, remember, you are not alone and help is available. Please visit breakthestigmaobx.com for more information and resources.